Hi, this is Jessica Fox, filming for Vett222, task 21, which is perform a postmortem examination, necropsy. So I have DVM, Dr. Wortel, here with me to help me out with this. And this is the patient we're going to do the necropsy on. So I have my OCCI certificate here at the Lafayette Veterinary Clinic. And then some formalin jars. I'm going to take notes as far as what the DVM tells me. And we'll go ahead and get started. So first we're going to acknowledge the patient history, and this is a male lab rat used for research, a research study. He is expected to be healthy, other than the fact that I do want to mention his hind limbs have been removed, collected for lab research, and there is an incision through his diaphragm. This was just to confirm death. He was euthanized by an overdose of carbon dioxide, and the incision was just to confirm that he had passed. So the first step is to examine the external appearance. So he looks to be in great body condition, and we don't see any presence of lesions or loss of hair, anything like that. No wounds or parasites. Looking at the mucous membranes, we want to make sure that they aren't either pale, red, or blue, and these look pretty normal.
Yep, they look good.
All right, so it is important to know the normal anatomy to realize the abnormal as far as size, color, shape in any organs. So doing a necropsy, we're going to start in left lateral recumbency, and always perform the necropsy the same way so you don't miss anything. In some places we'll document everything with photographs. So we're going to start in his armpit because there is loose skin and it's a good place to start. And we'll go up to his jaw. Make sure you can see here, bring you a little closer. And then from the armpit down to the inguinal region, careful not to cut any underlying tissues. All right, so we're going to open up the abdomen cavity, being careful not to damage the tissue underneath. So we're going to open the thorax and start there. We're going to open a window to observe the diaphragm, which has already been cut, but if it hadn't, there should be negative pressure. And we like to open the thorax and abdomen on the dorsal side, and this is because if there's any free fluid, you don't want it to pour out on the bottom, so you'll be able to see it and collect the sample and send out if it's there.
This is just getting into the abdomen now, so we're cutting the peritoneum. And then as just mentioned, we're going to be going into the thorax, and again, if it hadn't been a cut already, looking to see if the diaphragm had negative pressure, which would be shown by it springing back from the organs.
Perfect. And we are making sure that everything is still in place. We're looking for abnormalities.
And we can see here that just based on visually before even disrupting any of the tissues, everything looks to be in pretty good size, shape, or color.
All right, so we're going to start going through the organ systems and collect just a few example tissues. In certain circumstances, you might collect even 2 of everything because depending on the test needed, the sample might need to be fixed or frozen. But first we'll start with the salivary glands, which are right under the mandible.
There we go.
All right, and then the next thing we're going to go to the chest, in which we'll pull back on the trachea so you don't damage the heart or lungs trying to remove them. But the heart and lungs will be removed in one chunk. Perfect, yep, so there's the trachea there. And we're going to use gentle backwards traction.
So there's heart, lungs, thymus, trachea.
All right. And I do want to mention what we'll do is remove all the organs and then separate them for tissue collection and send out. So next we'll move on to the GI tract. We'll remove the liver and GI tract in one chunk. We're going to leave the reproductive tract, kidneys, and urinary tract, so we'll grab the diaphragm and use gentle traction again to remove the entire GI tract with liver and spleen. All right, and next we're going to move on to the left and right kidney. Something I do want to mention is there are lymph nodes all over the body, and we should be looking at them to make sure they aren't swollen or have any abnormalities.
And so far we have not found any that look abnormal.
All right, so we're going to move on to the bladder and testicles. If there is urine in the bladder, actually you could collect that urine if needed.
And his is pretty empty here, so here we see his bladder, just pretty empty, so we wouldn't really be able to collect a sample. Here's his little parts of his reproductive tract as well, so we can collect those along with his bladder. And then we have our testicles.
All right, perfect. So,
and then the other things that you could possibly do, depending on the circumstance, is collect other types of tissues such as muscle samples, nerve samples, bone samples. Great place to do that is the hind limb. In this specimen, unfortunately, we don't have those anymore, as just mentioned, since this was a lab rat where those were used for research purposes. But otherwise, alternatives would be something along the lines of the humerus and the brachial plexus, or those muscles, nerves, and bones. Other samples you can also collect include the tongue, opening joints to actually observe for signs of infection or inflammation in those as well, but we won't pursue those in this specimen.
and then other things you would want to collect are the eyes. You could collect those by going behind the eye and cut the optic nerve. All right, perfect. And then another thing you would want to collect is the brain. So you'll cut through the skin on the back of the head, and they have a pretty thin skull. So when cutting, you'll just need to be very careful as to not damage the brain in the process.
So here we just cut to disarticulate the actual skull from the neck. And then as just mentioned, the skulls are very thin in rodents, so you can cut through them, again, being mindful ideally not to disrupt the architecture underneath. And then we can collect the brain carefully. Again, this specimen has been frozen and thawed, so it's not as fresh as a typical sample. But we can see here the architecture of the brain with the frontal lobes and the cerebellum.
All right. So we will need to collect and package some samples to send out. So I'll grab these over here.
And in this instance, just as an example, we'll collect the heart, the lungs, the liver, and the kidneys. So here we're just separating the heart and lungs. And so we have lungs that we're going to place in this formalin sample, which Jess is going to label for me.
All right, so these are the lungs. So I'll go ahead and label that as lungs. Okay.
And then we also have the heart available.
So we'll label that. See that.
Now the liver is a larger sample, of course, so if necessary, if we were interested only in certain lobes, we could cut that up as needed. Otherwise, we can collect the full thing into formalin.
All right, so there's the liver, and then moving on.
Finally, we'll do the kidneys.
Perfect. So all the remaining tissues will be disposed of properly, of course. So let me label this really quick. Kidneys. And then I do need to document any observations made by the DVM in the medical record.
And in this case, as she had mentioned at the beginning, this was a healthy specimen, and that was corroborated by this necropsy. So there were no gross abnormalities found. Everything appeared to be in good condition. It's in good body condition. Organs were normal in size, shape, and appearance. And really, we found no gross changes.
Okay. Perfect. And this completes task 21, the necropsy.